Did you know that in many hospitals, claims are returned, claims are denied, and goes to legal because nobody is on top of Philhealth claims in the hospital? Doctors and hospitals go about it the wrong way. After spending almost 2 decades in claims processing, I can say that hospitals have assigned staff in claims processing, but nobody is on top of hospital claims processing. So what am I talking about? You may even say, are you crazy? So, by the end of this video, you will discover the deeper meaning of hospital claims processing and its importance in preventing RTH and denied claims. You will discover that claims processing is related to so many factors in the hospital. So friends, let us begin. Claims processing involves the relationship of health services rendered to the patient and the request of compensation based on the services that was given. Now, this is very deep. Many hospital leaders believe that hospital claims processing is the simple conversion of a medical bill to an insurance document, wherein it involves one office and probably 3 hospital staff. Period. The end. That is the classic misconception of claims processing. So, in reality, claims processing involves clinical services by health workers like doctors, nurses, diagnostic people. It involves non-clinical services like medical record staff. You have accounting and admitting staff. It involves accurate documentation as proof of services like clinical charts, lab results, charges, or billing statement. It also involves the eligibility of the services like Philhealth Member or not a member. It also involves quality standards like the clinical practice guideline or accounting standards. It also involves specific time period like date admission and date discharge. So the 3 reasons why nobody is on top of claims are the following. First, hospitals assume that claims processing is under a single office. So many hospital leaders believe that claims processing starts and ends in one office. Now, this office is the claims office of the hospital. So I'm pretty sure many of you are guilty of this. So, Philhealth claims is all about information. So the source of information involves the doctors, the nurses, the laboratory staff, the diagnostic staff, and many more. Now, the source of information comes from different offices and different personalities. The accuracy of the information in your claims is dependent on the reliability of all these people. If your source is incompetent, lazy, and does not care, the information in your claims will be incorrect and inconsistent. Your claims will be returned or be denied. If nobody is on top of claims processing in the hospital, okay, it will be perceived that the claims are assigned to the claims office alone. So, this brings us to number 2. The failure to link information from one office and other personalities. So after spending almost 2 decades in claims processing, I have observed that many healthcare providers lack linkages between their offices. Many assume that there is no need to link the information from other offices. So many departments in the hospital are either disconnected from each other or the offices are just plainly disorganized. So what do I mean by this? So, the flow starts when the patient comes to the admitting office for patient registration. Now, the patient is seen by the doctors and the patient is seen by the nurses, wherein clinical information is written in the chart. So, clinical management is done. Then eventually, the bill is prepared and then the patient is subsequently discharged. So, the clinical chart goes to the medical records. The bill and the clinical information are then converted into a claim document. So the claims are sent to Philhealth electronically. So someone must link all the offices involved in the claim. The doctors or the nurses are dependent on the admitting office. Doctors need lab results to assist in management and diagnosis. The diagnosis comes from the doctors. The medical records are dependent on the doctors and the nurses. The ICD-10 codes depend on the final diagnosis. Billing is reliant on charges that are documented by the nurses. So basically, claims or the claim forms depend on all of them. The claims office needs IT people to send the claims to Philhealth. As you can see, one office is dependent on the other office. The efficiency of one office or one group will depend on other offices. Now, if these people are disorganized, your claims will not be paid. If nobody in the hospital will link these offices, your claims will not be paid. If nobody is on top, your claims will not be paid. So this brings us to the next reason: poor leadership and ignorance. So many hospital staff is involved in preparing the claim. Each has a specific role to perform. Now, each has a specific output to deliver. Someone in the hospital should rise up and lead everybody to guarantee that everybody will perform their task and deliver their output. Someone must lead and manage the admitting team. Someone must be in charge of the clinical staff. Someone must coordinate with the medical records, accounting office, and the billing office. A competent leader is required to manage the internal transaction related to hospital claims processing. Now, unfortunately, many facilities do not have a leader who is competent and has a wide background in Philhealth concepts and rules. Poor leadership leads to unclear monitoring of claims outcome. Claims then end up as returned, denied, or even goes to Philhealth legal. If nobody is on top, your claims will not be paid. So the three reasons why nobody is on top of claims processing are the following. First, leaders assume that claims processing is under one office alone. Next, there is failure to link the information among offices and persons. And lastly, there's poor leadership and ignorance. It will bring your hospital finances to the ground. Now, in the next video is all about the value of information in claims processing. My friends, this is Coach Doc Ben. See you in the next session.